Hello everyone, my name is Mustafa and I'm a fifth year medical student in Cairo University and I'm passionate about AI. I'm very excited to be presenting to you today a recent publication in the journal Artificial Intelligence Surgery about data recording in the OR and the exciting opportunities it presents. Before we start, I would like to thank my great mentor Dr. Hiba Tahir, consultant of pediatric surgery and editor in the journal Artificial Intelligence Surgery. Dr. Hiba is one of the brightest minds in our institution, and she's a strong supporter of AI in medicine. Let's start by defining what a white paper is. White papers are informational documents that are concise in nature and are usually used to highlight a specific issue or its solutions in a factual and clear way. White papers are usually the outcome of an extensive research on a specific issue, and so, although they are built to be concise, yet they don't miss any important point. Now, moving on to the next slide, let us start by telling you how valuable medical data is, yet also how confidential and private it is, and that it's of the utmost importance for healthcare professionals to protect and secure their patients' data. The authors in this paper start by mentioning the benefits of data collection in the OR and explain how valuable it is to train AI models in the future, which will ultimately advance healthcare and the outcome of surgeries. For this paper, the authors decided to establish a task force constituted by a team of experts in the field of AI in surgery in order to identify the challenges that prevent the wider use of data collection in the operative setting. And this was the purpose of this white paper document, which is to identify the main issues that need to be tackled in order to have a successful and effective data recording process in the ORs around the world. So, they identified 9 main issues that need to be addressed, which are the issue of consent, the technical requirements needed for proper data collection, the issue of data use and access, the issue of data privacy and security, data retention, data ownership, the issue of governance and auditing, the financial costs of data collection, and the impact of data collection in the OR on medical malpractice claims. In the next slides, we will briefly discuss each of these points. The first issue to consider when it comes to data collection in the OR is that of consent, not just from the patient, but from the surgical team as well, especially when it comes to video recording. Before any recording of data is done in the OR, the patient and the medical staff need to give an informed consent about what data will be captured and how it will be used and how long it will be kept. Secondly comes the challenge of the technical requirements needed for proper data collection in the OR. The experts in this matter noted that the type of recording devices used is a very important factor to be considered and needs to be considered on a case-to-case basis. Devices that store these valuable and private patient data needs to be compliant with the safety and privacy standards required by regulators around the world. Another point the authors highlighted is how the data will be processed after being recorded, either by using AI models to de-identify the patient from the data collected or to code the protected health information of the patient that could compromise their privacy and to make it inaccessible to any person viewing the data casually. Hence, the experts identified that devices and programs used in data collection in the OR are important factors to be considered in order to have a safe and effective data collection process in the OR. The next issue the experts mentioned is that of data use and access. After the data is successfully recorded and processed, how will it be used and who will be given access to it? They noted that accessing this valuable and private patient data needs to be considered on a case-to-case basis by an expert regulating committee, especially if it's given to a third-party organization or individuals. Hence, a policy for accessing and sharing the collected medical data needs to be put in place in order to protect the patient and their confidentiality. The fourth challenge that needs to be considered, as noted by the task force experts, is that of data privacy and security. The experts suggested that recording and collecting protected health information, such as the patient's medical history and their current health status, among others, needs to be kept to the minimum in order to protect the patient's confidentiality in cases of any data breach. The authors also noted that data needs to be protected using highly secure computer programs and that the data should be stored for a limited time for research purposes, then discarded of safely. And this brings us to the next point, which is the issue of data retention and the proper disposal of the data after its use. The authors noted that it's not only about deciding when the data will be discarded of and limiting its use to only specific research purposes, but it's also important to consider how the data will be discarded of, both digitally and physically. The mechanisms used to discard this confidential medical data after its use needs to ensure that no trace of the data is left after its deletion, and most importantly, that the data cannot be linked to the patients themselves as an individual. Which brings us to the next point that the experts identified as an important issue to consider, which is that of data ownership. We should ask ourselves this question: who owns the data after it being collected? Is it the patient? Is it the operating physicians? Is it the hospital? The authors suggest that the ownership of the data should be decided before even collecting it to avoid this dilemma, especially when the data is used for commercial purposes, as the research for developing a new medical product, for example. The experts also suggest that contracts should be signed between the involved stakeholders, the patient, the doctors, the hospitals, third parties involved, in order to avoid any legal confrontations. Another issue the authors identified is that of the governance and auditing of the data collection process. The authors noted that it is of great importance that an external committee oversights the team collecting the data in the OR to make sure that they are following standards and regulations for safe data collection. This also might involve special training to the healthcare team involved in the data collection process. Another point the expert highlighted is that of the financial costs of the operative data collection process. The experts agree that there are extra costs involved in data collection and that the cost-benefit analysis needs to be conducted before undergoing in data collection. They also suggested that alternative sources of funding can be explored in order to get external funding for the data collection process. An example for this would be that educational institutions could fund the data collection process in exchange of them getting access to the data to use it for educational purposes. And finally, the last point that the experts identified is the point of the impact of data collection in the OR on medical malpractice claims. The experts noted that the availability of data collected from the OR will lead to improved reviewing and hence improved outcomes of surgeries. They also noted that a proper framework to use the collected data in legal medicine in case of malpractice claims should be developed, as the data collected will not be sufficient to convict nor to acquit the accused in a case of malpractice claim in court. To conclude, the expert identified 9 main challenges faced when it comes to the wider application of data collection in the OR. In their white paper, they pointed out the important factors to consider when tackling each of these challenges, ultimately paving the way forward for a policy and framework to be developed in order to achieve a safe, effective, and universal operative data collection system. Thank you.